Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great tip for curling motions for biceps training with shoulder pain. Hope you enjoy. So there's a lot of you out there training biceps that have a tendency to irritate your shoulder, either in the front of the shoulder, sometimes the pain can also be in the back. A lot of this is due to the fact that many people have a postural tendency to not only round their shoulders, but to have what's known as an anterior glide of the humerus, which is our top bone, our upper arm bone, where it has a tendency to slide forward in the socket. And as you're curling, whether you're doing preacher curls, barbell curls, dumbbell curls, spider curls, even chins, you're going to have a tendency to go with your strength, which is to use the bicep in an inappropriate fashion to drive that arm forward because you don't have the proper rotator cuff strength to keep it maintained in the socket. So when curling, what I would suggest you do, first of all, to make sure that you have this problem, is take a Posture Size or Pain Free and Fit examination at our self-analysis page on both the Posture Size website or the Pain Free and Fit website. We go through a whole body analysis for you to learn your mechanics there. But see if you have a normal posture, a tendency while you're curling, while you're working out, to lose that flat front of your shoulder where you're going to round, or have a training partner put his or her hand on the side of your shoulder, and as you're curling, see if that upper arm bone is not actually traveling forward in the socket as you're curling, as opposed to staying back in the socket. If that's the case, where you have an anterior glide of the humerus or upper arm, or a rounded shoulder, we need to make sure we start training with a lighter weight first and just the weight of the arm to get the motion down, where we curl, keeping the blade pinched together so that we have a flat front of the shoulder. That would be an overcorrection. We just want to make sure it's flat here and not rounded. And we move our upper arm bone away, if we touch the front of our shoulder, away from our finger. That little motion. You notice I'm not moving my elbow or wrist, I'm just sliding the upper arm back in the socket. So the two corrections again are shoulder blade flat, upper arm back in the socket. It's a tiny motion, maybe 1/8 of an inch, but that's essential. As we curl, we want to make sure we're keeping that upper arm back in the socket, using the rotator cuff muscles. That's what's actually helping to hold it there. And then once we get that down, we're going to transfer that into a curl. Normally, if you're curling with this problem, the shoulder will round a little bit and the upper arm will move forward as we curl. What we want to do is we want to make sure that the front of the shoulder is square. We want to make sure that we feel the arm moving back from our finger as we curl. That's training the biceps correctly. Whether we're doing hammer curls, whether we're doing reverse curls, whether we're doing straight supinated curls, either variety, we want to make sure that arm is centered in the socket, sliding backwards as we curl. It's easy to do with one finger if you're on a one-sided curl. After you get good with one side, I invite you to try that with a bar and put it into your chins. If you have any questions or comments about this style of training to help preserve your shoulder, so impingement problems and biceps tendonitis or less, please feel free to subscribe to our channel. We've got a lot of great shoulder exercise and rehab programs, also available on our Pain Free and Fit website. If you'd like to help me share this vital information with a lot of other people training with injuries, give me a thumbs up below. Any questions or comments, please leave them and I'll do my best to get back to you. I hope this short tip helps you with bicipital and rotator cuff impingement problems in your shoulder while curling.